Hello, my name is Luu. I'm a research assistant at the crew. I work with Dr. McKnight and Dr. Van New in a study to explore the socio-technical context to inform the implementation of in-CU innovations. Our study sites including hospital of tropical disease with a tertiary hospital specialized in infectious disease, and Đồng Tháp Hospital, which is a provincial hospital and more typical to other hospitals across Vietnam. We use ethnography method. It is a qualitative method to involve depth study of a group of people through observation and interview, including formal and informal conversation. We are interested in Vietnamese ICU we want to understand the structure of the organization, the shift, learn about the task of nurses and doctors that are not written in any document, especially how they monitor vital signs and doing the handovers. One key technology is the wearables for vital sign monitoring. We have conducted 35 semi-structured interview with ICU nurse and doctor and 200 hours of observation across on shift at the two hospitals. These are the preliminary findings that I'm gonna present in the next slides. Overwork, we see that the nurse have so many routine tasks to complete, but beside that they have to respond to the alarm, to assist the doctor with emergency and procedures, and broken routines mean that vital sign is not taken in a timely manner, and it's common that they have to speed up to prioritize the patient for care. As you can see the quotes from one of the nurses that they really busy with patient taking care of patients, and sometimes they have to spend extra time after work to do some of the administrative work. So about the administrative and finance, beside the direct patient care, they have to take care, both doctors and nurses have to take care of administrative work. Data primarily serve the admin and financial need of the hospital. The recording of vital sign is part of the process, and the data is used to justify the treatment and for health insurance reimbursement. So the nurse monitor vital signs as the doctor's indication in 3 hours or hourly, depends on the condition of the patient, and vital sign monitoring is carried out as a task. So first it serves the administrative work, but it's also used dynamically by doctors and nurses to assess the patient. At hospital of tropical disease, nurse, they memorize the vital signs. They make note and update in the electromedical record when they have time or at the end of the shift. Doctors not appear to check the vital sign frequently on the medical record, but they use that to plan care when they print it the next day. At Đồng Tháp Hospital, the way they monitor vital sign is slightly different. The nurse still use the patient sheet that they keep at the bed, the patient bed, so they monitor signs and they write in the sheet right away. So the doctor's more likely to look at the graph of the vital signs parameter to for the decision making. Another interesting thing we see is like how the nurse respond to abnormalities. The experienced nurse will check the parameter and handle within the abilities to before they report to the doctors, and the inexperienced one would check and so the nurse who newly graduate from general training have to learn a lot that require a steep learning curve for them. So normally they have the assist from the more senior nurse. So this is one of the nurse told me that when they first come to the ICU, they don't know anything, and it's really pressure to keep up with the work. So the challenges we found is like in the implementation phase, like with the new technology, how it's best serve the administrative and the dynamic purposes. Sometimes the connection, the battery issues create more work for the nurses that require extra staff, and possible just benefit more for the doctor, but not really beneficial for the busy nurse. That's all from me. Thank you for listening, and please have a question.